Hey there, health warriors. Did you know that blood clots can be life-threatening if not caught early? Deep vein thrombosis, or DVT, is a condition where a blood clot forms in a deep vein, most commonly in the legs. If untreated, it can break loose and travel to the lungs, causing a pulmonary embolism which can be fatal. But the good news? DVT is preventable with the right precautions. Today we're breaking down how blood clots form, who's at risk, and how to prevent DVT before it becomes dangerous. Let's get started. DVT occurs when a blood clot, or thrombus, forms in a deep vein, most commonly in the legs or pelvis. These clots can partially or fully block blood flow, leading to pain, swelling, and serious complications. Why does this happen? When blood doesn't circulate properly due to immobility, surgery, or certain medical conditions, it can pool and clot inside the veins. The biggest danger? If the clot breaks loose and travels to the lungs, it can cause a pulmonary embolism, a life-threatening medical emergency. High-risk groups for DVT: people who are immobile for long periods, hospitalized patients, bed rest, long flights or road trips. Post-surgical patients, especially orthopedic surgeries like hip or knee replacements. Pregnancy and postpartum women have an increased blood clotting risk. People with clotting disorders such as factor V Leiden, protein C or S deficiency. Obesity and smoking can lead to slower blood circulation. Cancer and chemotherapy patients have an increased clotting risk. Oral contraceptive and hormone therapy users, as estrogen raises clotting risk. If you or a loved one falls into any of these categories, DVT prevention is critical. Common symptoms of DVT include swelling in one leg, especially the calf or thigh pain or tenderness that feels like a deep muscle. Cramp, warmth and redness over the affected vein and veins that look larger or darker than usual. Signs of a pulmonary embolism, or PE, require immediate emergency help. These signs include sudden shortness of breath, sharp chest pain that worsens with breathing, rapid heart rate and dizziness and coughing up blood. If you or someone you know has leg swelling, pain or breathing difficulties, seek medical attention immediately. To prevent DVT, stay active and move your legs. If you're sitting for long periods, whether traveling or at a desk job, be sure to stretch and walk every 1 to 2 hours. For post-surgical patients, do leg exercises or get out of bed as soon as you're allowed. Using compression stockings can help prevent blood from pooling in the legs, and are often recommended after surgery or for high-risk individuals. Staying hydrated is crucial. Dehydration thickens the blood, increasing the risk of clots, so drink plenty of water, especially during travel or hospitalization. Avoid prolonged sitting or crossing your legs, as sitting still slows circulation and increases the risk of clots. On long flights or car rides, do ankle pumps and stretch your legs. For high-risk patients, doctors may prescribe anticoagulants or blood thinners, such as heparin for immediate clot prevention in hospitals, or warfarin, apixaban, or rivaroxaban for long-term use. It's important to always follow dosing instructions since blood thinners prevent clots but can increase bleeding risk. DVT prevention is simple but life-saving. Small changes can significantly reduce your risk. Diagnosis of DVT typically involves a Doppler ultrasound, which is the gold standard for detecting clots. A D-dimer blood test measures clotting activity in the blood, and a CT pulmonary angiography can detect a pulmonary embolism. Treatment options for DVT include blood thinners or anticoagulants, which prevent clots from growing, and thrombolytics, or clot busters, used in severe cases to dissolve clots. An IVC filter is a device placed in the vein to catch clots before they reach the lungs and is used for patients who can't take blood thinners. If caught early, DVT can be managed effectively, and serious complications can be avoided. DVT is preventable and treatable when caught early. By staying active, staying hydrated, and recognizing symptoms early, we can reduce the risk of life-threatening complications. Have you or someone you know experienced DVT? Share your story in the comments below. Like this video? Give it a thumbs up. Subscribe for more healthcare education and patient safety tips.